Aside from the many international issues before President Trump this week, his first major push on domestic policy is facing an uphill climb in the Senate. John Yang has this checkup.
When last we left the saga of the Republicans' attempt to repeal and replace the Affordable Care Act, Majority Leader Mitch McConnell didn't have the votes for the Senate bill, so lawmakers headed home for the 4th of July recess. Where do things stand as the recess ends? Let's turn to our own Lisa Desjardins. So, Lisa, has this week off helped or hurt McConnell's efforts to get this bill passed?
It has not helped, and that has hurt. You see some Republicans who are not usually in the middle of these situations, like John Hoeven of North Dakota, for example, meeting not just with constituents, but with hospital administrators, those kinds of people. And he came away from those meetings stressing problems with the bill. Then yesterday, Mitch McConnell, the majority leader, spoke to a Rotary Club in Kentucky. And he said this quote that got a lot of attention. "If my side is unable to agree on an adequate replacement, then some kind of action with regard to the private health insurance market must occur. No action is not an alternative." His office insists he's said things like this before, but the timing is key. This was a bill that was supposed to be voted on already. John, leadership sources tell me they would still like a new revised bill next week, maybe a vote the following week, but that seems unclear now if it will really happen.
Seems like Mitch McConnell was sending a message. So who are the key players that he was sending that message to?
You got it exactly right. We talked so much about moderates before. Now it's all about the conservatives. He was saying to conservatives, we have to revise this bill or we've lost our shot of having anything as Republicans. Let's compare two conservatives that spoke in town halls yesterday. Sound bites. First, from Texas Senator Ted Cruz.
2010, 2014, and 2016, repealing Obamacare was front and center. Now, I recognize that some folks may not agree with that, but the voters repealing Obamacare was the single biggest factor producing a Republican House, a Republican Senate, and I think ultimately a Republican president.
So that's an animated Ted Cruz. He's trying to change this revised bill to try and get it across the finish line. But compare that with Kansas Senator Jerry Moran.
I believe in the legislative process that allows public debate, public discussions, testimony, amendments offered by all senators. Bill comes to the Senate floor, amendments offered by all senators, and figure out where there are 60 votes to pass something that is so important to so many Americans.
How about that key number? 60 votes. That means Democrats would need to be involved, and that's coming from a conservative.
So what are the options? What can Mitch McConnell try to do to get the votes he needs to pass a bill in the Senate?
There are no easy options left, but there are three options that seem to define the possible paths right now for Mr. McConnell. The first is to revise the bill. That's what we've been talking about. They do hope to offer a revised bill soon, but can it get enough votes? Unclear. The second is a full repeal. That's something Rand Paul and Ted Cruz want. However, with that full repeal would come a replacement later, and many of my sources in the Republican Party say that's too risky.
It's also an option the president raised last week.
That's correct, but it doesn't seem to have the votes right now in the Senate. Then the third option would be smaller fixes to the Affordable Care Act, something that stabilizes the market and fixes what people think are problems now. That would involve Democrats as well.
That would keep ACA essentially as it is, just make little nicks and cuts around the edges.
Potentially, it'd be a much smaller bill at that point.
That's what the Democrats want.
That's right.
So as we sit here with the Senate about to come back next week, what are the odds? What are the chances what does your gut tell you about the chances are of A, the Senate passing something, and if that happens, B, getting something to the president's desk for his signature?
Well, I have the sense that almost no one knows exactly what's going to happen now, but I would say given that and given the way the Senate works, the odds are long, both on a bill passing the Senate and even longer on it getting to the president's desk as things stand right now.
But the odds are good. You're going to have a busy week next week when the Senate comes back.
I think so.
Thanks, Lisa.